We are back
We're
again.
back. We're back. Welcome back, everybody. Thank you for joining us. My name is Dr. Sheri Gibson.
And I'm Dr. Regina Lewis.
And we are here for another wonderful discussion brought to you by the State of Connecticut Long-Term Care Ombudsman Program through a very generous funding through the CARES Act.
Oh, that's fantastic.
Yeah, it's great. We're very grateful to be able to share this information with our viewers and people across the state of Connecticut.
Wonderful. So, Sheri, what are we talking about today?
So today we're going to talk about a really important, another important topic that again is affecting so many people, not only here in our nation, but really globally, and that is grief.
Oh, what a great topic. I think it's really important during these times. Mm-hmm. People are grieving.
People are.
And there's no we know a beginning, but we don't know the end because there's always something else.
Oh, you are so right. You are so right. I mean, since the very beginning of this pandemic, I don't think we've really fully appreciated the long-term consequences of prolonged grief. And that is the impact that happens for many people over time consistently after experiencing either the death of a loved one or the loss that's not a death.
Oh, absolutely.
Right. Loss of what normal used to look like.
Right. Exactly. Mm-hmm. Because, they keep using this new normal, right? Mm-hmm. We are headed for a new normal. I mean, we're not even headed, we're there.
I think so.
And it's going to continue because the one thing that I could say is consistent is uncertainty.
Uncertainty.
And with uncertainty comes a lot of grief because it's the next thing and then the next thing. I remember Sylvester Stallone, he said, when you get knocked down 24 times, you get back up 25. But how do you do that in the midst of a pandemic when you feel like you've got a hold on things, something else comes up? Or you go through, I have a cold. Well, is that really a cold or is it COVID? And people, their minds start to go. Yep. And then once they hear a family member or themselves have gone through something during these times, they start to grieve. Mm-hmm. But what people have done in the past with grieving to get through it is know that they would get through it and that it would be the light at the end of the tunnel. Mm-hmm. But when you continue to have something else and something else,
absolutely,
what are we doing?
It takes a toll on everything about us. It takes a toll on our physical well-being, our spiritual well-being, emotional well-being. And there's this existential crisis that comes along with that.
Right.
When I work with older adults who are experiencing grief or families in long-term care, for example, there's a couple of things that are going on around the existential issue is people are asking, where is God now? God has abandoned me. God wouldn't let something like this happen to good people. Right. And it's our way or our brain's way of trying to make sense, trying to get meaning from it. And when life is so fragile and at such a mass number of death that we have seen and loss that we have seen that is unprecedented.
Right.
None of us in contemporary days can even fathom what that's like, and we've never had anything to compare that to before. Right. The one thing that you're talking about too in psychological terms is anticipatory grief, waiting for the next shoe to drop, right. or anticipating that you're going to either lose your own life or a loved one is going to die. And it's in that anticipatory grief where anxiety then starts to manifest itself. And we're starting to prepare for the worst thing to happen. How am I going to cope with it? What is it going to look like? People are already thinking about their own obituary or how I'm going to talk about my mother or my father when they die. And that also, in addition to regular grief, the anticipatory grief, takes its toll on our psyche as well.
Absolutely. And so, one of the things that I want to share during our time together is really bringing in the cultural aspect of
Right.
that. So, we'll be talking about being culturally responsive. So, being culturally responsive is really taking it and looking at another layer. That's the intersection of people that, even though you and I are both women, and we're both experiencing what's happening in the pandemic, our lives are so different.
Mm-hmm.
And so how we are experiencing it is very, very different. I experience it different as an African American. I experience it different based on, the region I live in or my degree. That's something we have similar, but we both have our PhDs, but there are other areas. And so when you're talking about being culturally responsive, especially as a caregiver, then what you want to think about is not just that's my job and I'm taking care of a person who is a senior. That senior has so many layers to them.
Right.
They have different ways that they grieve. They have different challenges and different concerns. And how do we address that in a unique way without overwhelming our own selves, right? And so we'll talk about some of those different areas that have been major concerns as well.
Exactly. And kind of dovetailing off of what you've just said, that grief is not a single emotion.
Mm-hmm.
Grief it's an experience or a state of being that manifests itself in the physical realm, emotionally, spiritually,
Mm-hmm.
and that there is not one size fits all in how we grieve. One of the things that we're noticing about grief and mourning during this pandemic is that in our society, mourning, I think, even universally across different cultures, is that we mourn, we grieve in communion with others. That is part of our culture, in Western culture, the way that we do that. And what the pandemic has changed for us is that we can't do it in the way that we did it before.
Absolutely.
We can't do it with each other. The importance of touching. You and I've talked about this before.
Absolutely.
That, my memories of being at a funeral, for example, is having my arm around the person I'm with, whether that's my mother or my father, or holding the hand of somebody next to me.
Right.
And when we're communing together in the reception hall after a funeral, there's a lot of touching that's happening.
Right.
And in this era of e-mourning, where we're having to do these either virtual funerals or drive-bys that we've heard of, there's not that touching aspect is not a part of our mourning and our grief process. And I can't help but think what that long-term impact is for us to not have that important piece of our ritual.
Absolutely. And will we go back to that ritual? Because I think about our children and what will their rituals be. Thinking about it culturally, there are cultures that leave things, there on the funeral area, like in the grounds and on top of the casket or around it. And that's part of the ritual that possibly has been removed. Some people have been able to manage a little bit, but not everyone. I mean, look at the people who, you may have a few people that are there physically for, say, the funeral, but what about those individuals that are not, that they have to rely on somebody else, that they can't personally go and touch, as you say, touch the casket, touch the person next to them, being able to say what they need to say in the moment. And so what that does is it feeds into that grieving once again, because now not only did you grieve over the loss, but now you're grieving over the fact that you could not grieve the way that you needed to. So then that stays in your mind even longer. And so later we're going to talk about how in the world do you deal with that. But also I'm just thinking about grieving oftentimes is linked to oppression. Because there has been many people who have been oppressed. and they have had to go through this grieving period all the time. And the moment that they believe that they are up and out of the situation, something else happens to bring them back down into that same space. This is a huge concern. And I'm sure that our audience, there's many of you out there nodding your head like, yes, yes, I'm feeling it. I notice that the people I care for feel it as well and are trying to work through it and deal with it.
Right. And I'm wondering too that, this profound loss of meaning, around, and you and I've talked about the narrative. What do we tell ourselves about the death of what's happened? I mean, one of the things that, one of the aspects that is specific to COVID is the shock of the unanticipated death. And as a community, as big communities where we have heard on the media, fairly healthy people, younger people dying, my loved one got sick on a Friday, was dead on Sunday.
Yes.
That kind of shock of the unanticipated death, what that has, that impact that it has. And I think the other thing around the oppression piece, when you talk about different cultures that, have experienced over and over again that kind of cycle of grief. We get back, we pull ourselves up, and then something else takes us down.
Right.
Within that, it seems that there is again the strength. Where do we find the strength in it? The resilience.
Right.
And when I hear the word resilience, there's two definitions through Webster Dictionary. One is that of, I think of resilience as a rubber band. It's the ability to be stretched, bent, pulled out of shape, and then it retains its shape after that.
Right.
But the psychological definition is the ability to bounce back, if you will, from adversity.
Right.
And it seems that when we think about from a multicultural perspective or through that lens,
right,
that we are talking about people who are very resilient. And
yes,
how do we tap into the resiliency of people while they're grieving?
Right.
And what can we learn about people and their resilience to help them through that, to come out the other side, maybe even being stronger and more courageous to adapt and face the next challenge that is ahead for them.
Absolutely. You had mentioned when we were having a conversation about ruminating. And what happens is a lot of times people, when they're ruminating, they just continue to play the same thought in their mind. They start to just continue to have this, and they're consumed with that information.
Right.
And so when we start thinking, okay, this has happened, the first time that you have that information is the most shocking. And then immediately healing takes place, regardless if we know it or not. But sometimes we have to acknowledge it. We have to realize, where are we standing on all of this?
Yes.
And where do we go from here? And then start reaching back and saying, well, how did I get through the last one? Was it someone? Was it something? Because even if it was someone, you still had to make up your mind. Our mind is an amazing muscle that we have to use and tap into. To get out of ruminating, we have to come back to the present.
Right.
If we do not stay in the present and we're too far into the past, thinking about all the negative things that happened in the past, then that can lead to depression. If we stay too far in the future, concerned and worried about what is to happen, then that can create anxiety. And the combination of the two can actually come together. And one way to really start to work through that is to come back centered to the present.
That's right. And part of being in the present is acknowledging the waves of grief as we feel them. Some days it's going to feel like a small little lap on the shore type of wave.
Sure.
And there are other days that it feels like a tsunami.
Yes.
And so how do we stay present and let the waves of grief wash over us in the way that can raise our awareness to what we're feeling, to not stuff it down, to not push it under the rug, but to actually acknowledge and honor that grief as a part of the human process.
Right.
It's a part of who we are. It's a part of our expression. We express joy, we express sorrow. Grief is also a part of the human experience. So being in the moment, I think, is an important piece of that, important element to our healing.
Absolutely. We also should take into account, this cycle of how we actually process and bring out emotions. And so an event happens, and from that event, we start to feel something physiologically. So, your skin tenses up, your stomach, you have butterflies. Something is actually happening. And from those two experiences, we then interpret for ourselves what that means to us. And then we have the emotion. Right. And that's where grief actually sits. And this continues to cycle itself. We may not be able to control the actual experience or even what we feel physiologically, but we can control our interpretation of it. So how can we interpret it differently? What can this actually mean? So I know that in some cultures, they look at death as a celebration. So when we start thinking about people who came from Africa who were enslaved, and one of their family members or friends actually passed away, they brought it into celebration as a way of saying freedom. So that was another way to actually look at it. I remember talking to a scholar, this was some years ago, and he was one of the Lost Boys. If you don't know about the Lost Boys, you should really look at that. But they were coming from Sudan and walking, and they were young, like 8 years old, walking and just trying to save their lives. They got picked up and was flown. Several of them were flown here to America. But they talked about how as they were walking, wild animals attacking some of the people who were walking with them or drowning in water. And I said, how did you survive that? How did you not end up with PTSD? And the young man said to me, he said, we had to think of it differently. Differently. And once you do and you really believe it, it stays with you to the point where it does not create a negative effect on your entire being for long periods of time. You can actually move out of that.
Right. Yeah, and that opens the door for during this time of the pandemic where people can find creative ways to express their grief, to memorialize their loved ones in ways that they hadn't done before. I've worked with some people who will do things, of course, we're having to mourn individually, mostly, at the individual level. But, setting balloons off, writing a letter to your loved one or the one who has passed, tapping into memories that were important to you, that were meaningful with that person, and sharing those memories with other people can be a way that we preserve the memory of that person and we honor the life that's been lived.
Absolutely. It also gives us an opportunity because now we have media, so we can get it out to so many people. You could do something on YouTube. You can do a podcast. A ritual that I've actually seen was just taking a bowl of sand, praying over it, and then grabbing the sand up and holding it as if, this is all the stuff that I'm holding on to, and letting it fall between our fingers to just let it go. There's a sense inside. Taking a moment to just breathe. I believe you talked about breathing before. Just to breathe and to bring it in. I started thinking about some work from Dr. Abe Wade Boykin, and I mentioned this in one of the other podcasts, and it's his 9 dimensions of African American culture. And so I'm going to read the 9 dimensions and then talk about how some of those can actually be a way to be culturally responsive and
Right.
to help work through grieving. So he talks about spirituality as being one. And so, as African Americans, and not just African Americans, there's other cultures that are very spiritual. This is what we have used to survive and to hold on to. And so, tapping into the spiritual community, into your spirituality, realizing that there is something much bigger and larger than yourself, because sometimes we get self-absorbed. So we have to start to look at the bigger picture there. Then there is harmony, is another one that Dr. Boykin talks about, is just that harmony and being able to move and flow. So how do you get back into the flow of things? It could be through conversation. It could be just doing something new or going back to something you used to enjoy a long time ago. Then there is movement. We are a type of people, as you notice, I'm constantly moving my hands and everything. And so, if you're mourning and it hurts, put on music, dance around, move around, just start to have that movement. And you don't have to do this only if you're African American. You can do this as anyone.
Right, because this is one of the skills we talked about earlier. It's coming back into your body.
Absolutely.
Letting it move through your body in some expression.
Absolutely. I think that that's important. We're verve, really, we've got to keep moving. It's energizing. And so if a person is expressing it and they have a lot that they want to say and they have a lot of energy behind it, allow that to happen, because that's just naturally who we are as a people.
Right.
And then there is affect. We are emotional creatures. And what happens is say you as a caregiver, or you go in and you are talking to someone, they just lost a loved one, and you get emotional. That sometimes takes away from them being able to grieve. We've got to give a person their space and their place to allow them to do that, because that's part of the healing. We're communal. We're, communalism is just coming together. I mean, all the way back to Africa, all the way back to like Ghana, we had clans that would come together and they were communal. And so we operate as a community. So how can you be a community when you have social distancing? You can build family chats, text messages. And so you have groups, and when something happens and you send messages back and forth, you don't forget them. It's almost like this ongoing connection and ongoing relationship.
Right.
Or you can even do that online, just building that community in different ways. Just because we're social distancing doesn't mean that we cannot come together as a community.
That's right.
There's also that expression of individuality. Ask the question, what does it take for you? Share with us what you would do if we weren't social distancing. Well, how can we take that and make it so impossible today, just in a different way? So looking at that, then we have orality, and then the social time perspective. That social time perspective is so important, because even though we may not be able to socially be physically together, we can still spend that time together socially through conversation, through letters, through words and poetry. I mean, there's different ways that we can do that.
Right. I want to go back to what you said about individuality.
Yes.
I think where we can really be helpful is when we become curious about another person's experience.
Yes.
And we can ask them, what is it that you need right now? Oftentimes, I think we, as healthcare providers particularly, and as caregivers, we are put into situations where we want to fix. And you know who you are out there. You're a fixer. And caregivers are great at this. That's why they're so good at caregiving. They know how to resolve a problem. They're resourceful. And the other side of that coin is that we don't allow people to express their individualism.
Right.
And so asking a person, knowing that they are the expert in their lives.
Yes.
What is it that you need right now? What do you need from me right now? what would make you feel better in this moment? We're not going to be able to change the outcome of what's happened, but is there some small thing that you could do to make a big difference right now?
Absolutely. I think that bringing the reality in is really, really important.
Mm-hmm.
But also asking individuals, what do you need?
Mm-hmm.
How can I help you? It starts to make that person visible again.
Right.
Because a lot of times we're dealing with a group of people who, one, are dealing with ageism, separation. And so, seeing all of that is just a concern. So, how do you bring them back into the room, back into the space, and back into society? You say, I see you, and I care about you, and I want to know what I can do for you. If we decide what we can do for an individual, sometimes that's okay, but sometimes that can go awry. So that's what's called the writing reflex, where we want to write automatically. We have the answer and we want to fix it. And, as human beings, especially those who are health care providers or caregivers, that's what we do. We're built for that. But sometimes we need to take a pause and put the person back into it as well.
Exactly. And be resistant to our avoidance of talking about having difficult conversations and talking about difficult experiences such as grief. Oftentimes I think part of that ageism is that we approach older adults in ways that aren't helpful and that don't recognize their strength and their individuality, if you will.
Sure.
And so if we approach people not as seeing them as a frail older person that we have to dance around certain subjects,
right?
When we ask the tough questions of our older loved ones or the ones that we're caring for, if you're a professional watching this, when we ask those questions that are very difficult, notice if you're avoiding that because of your own not uncomfortableness around grief, around asking the question. This comes up a lot when I'm working with students trainees who are doing their clinical work in geropsychology. We often talk about asking about sex with older adults. This is really no different. How do you grieve? What are you feeling? And knowing that that is part of everyone's experience. And so allowing the question to sit there and sit with the person as they heal. In that quiet space, when we stop talking and we allow the person to just feel with our presence just as a witness to their grief, that in and of itself is so healing.
I believe that it is. I believe that when we do, we have to make sure, I call it the 7-38-55 rule, and that's basically that only 7% of our message is the words that we say. We have to engage our entire body. If we're asking the question, we need to make the eye contact.
Right.
We have to pay attention to our tone. We have to pay attention to our body language. And when we put all of that together, the other person can feel that energy.
Right.
And then there can be a connection, and then the person can take the time to speak. But we have to also pause and be patient for them to speak and to process. So I believe that those are really important pieces that can really help a person through the grieving times.
Yeah. I also think that there's some other tangible things that people can do in thinking through normal grief process. And that is that you need to find supportive people that you can talk about your grief with. And those people need to be they need to be ones that don't one-up you in conversation. You've been with these people, right? And this is the person that you start to say, gosh, I'm really having a hard day. I really struggled today. And they say, oh, you have no idea the kind of struggle I had today. So they're one-upping you. Can't be that person. It has to be a person that can really relate to you in your grief, can support confidentiality. You're talking about very intimate things about how you feel inside about the person, and if it was a death that was anticipated, that's very traumatic, and so you want to be able to do that in a safe, confidential space with a person. You want to think about maybe postponing any major life decisions during a time of grief. When we are at a heightened emotional state, we may not think through rationally all of our big decisions. So, moving or getting rid of things right away. These are big decisions that we want to invite you to hold off on a little bit longer. You might want to consider writing. We talked about expression of grief through dance, through poetry, but keeping a journal about your experience and about what you're thinking. And it may be your internal process. It might also be writing memories about this person, because while we may not be able to share in the ways that we have before, our thoughts have meaning, and getting that out of our head and onto the page can be very important and very healing in and of itself, the process of that. You want to participate in activities. Whatever is meaningful to you, throw yourself into it. Allow your grief to move through you in the moment, and then move on and throw yourself into activity. Participate in your life. Continue to engage in your life. Find a way to memorialize the person that you've lost, the loved one that you've lost. And if you can, there are a lot of creative ways that people are doing grief support groups now. Yes. Reach out to your faith communities. Many of them are either doing calls, or they are doing grief support groups that are done through Zoom or other kinds of video platforms. And reaching out to that. If you are employed and you're watching this podcast, your employer most likely has an EAP program, Employer Assistant Program. And in that program, you are offered free counseling services. Reach out to a grief counselor. If you don't have that important person that you can really share with, talk to somebody who has some specialization in grief counseling that can be really important and can help you rebuild and find meaning from your loss. And then I think I want to just go back to what we've talked about kind of in and out of this conversation, is that loss and the experience of loss is multifaceted. The loss itself is multifaceted, and therefore our grieving process is multifaceted.
Sure it is.
Everybody is going to do it differently. There is no one size fits all. I remember when my husband lost his father, and I'm a talker. I'm a psychologist. I'm a talker, and I process through talking. My husband doesn't do that.
Sure.
And he processes through introspection, kind of isolation, being very quiet and by himself. And I remember he lost his father-in-law early in our relationship. We were just dating at the time. And I remember just being so frustrated with it and saying, why won't you talk about it? Why won't you talk to me? And the more that I pressed for him to talk, the more he got.
That's right.
Right. And so recognizing that we all have different ways. And so if some people withdraw, or they want to go on a hike or a walk by themselves and they don't want to talk to you, not taking it personally, but saying, okay, this is their way of expressing and processing that grief.
Sure.
And so I also want to remind people that we've got to give ourselves permission to also be patient around our grief.
Yes.
It may take longer than what you think it should. It will pop up in unexpected times where you're driving your car, a song comes on the radio, and you're in tears.
Absolutely.
It may come when you see a certain scenery that passes you by, or you hear somebody say something, or you might see somebody from the back looks like the person you've lost.
Right.
And it just pops up all of a sudden. What we want to do is recognize that and know that grief is, it's something that we all have to move through,
Absolutely.
and that we can just be patient and kind to ourselves during that.
I think it's really important. And as we wrap up for today, as an individual or just personally, believe in yourself. Believe in yourself and have that self conversation. In other words, the intra communication, internally having the conversation. And when your mind starts to tell you you can't, then just say stop and shift your words, shift your thinking, so that you can do what's called cognitive restructuring the way that you think. If no one else is around, that's what you can do for yourself. And if there are other people around, have that conversation and support the person who is thinking in ways that they can't believe in themselves. Support them in going back to who they really are. It's been a pleasure talking with all of you. I'm Regina Lewis, Dr. Lewis.
And I'm Dr. Sheri Gibson. Thank you so much for sharing this time, and thank you, Regina.
Thank you,
It's been
Sheri.
great.
All right.
Take care.